Hey everyone, you're welcome to Ask Your Nurse platform, and here we discuss everything related to health and nutrition. On today's episode, we are going to be talking about febrile confusion and how to manage it at home. But before I proceed, I would like to welcome all my whole subscriber. Thank you for being there for me. And for those that are new here, thank you, welcome. Please like, subscribe, and share to your loved one. So today, as I've said, we're discussing about febrile confusion and what to do at home. Mostly febrile confusion is common between the ages of 6 months and 5 years, and is also one of the leading cause of death in children. And I will tell us the reason why it's one of the leading cause of death, especially in Africa. Number one thing, first, what to do when the child is convulsing. The first thing that you need to do is to lay the child on a flat surface. Make sure the child is laid down and you turn the child to the side. If the child is wearing a tight cloth, remove it. Let the breeze blow to the child. Then watch the time of confusion. Most febrile confusion is solved within 1 and 2 minutes, maximum by 3 minutes the child is calm and you can now take care of the child. But during this period, do not give onions, do not put spoon inside the mouth of the child, do not put finger inside the mouth of the child. The main reason why you shouldn't give things during this period is that the child cannot swallow, and when you introduce onions or you give any home remedy to the child during this period, instead of this home remedy going into the esophagus to the stomach, it will enter into the airway and it will block the airway. And the complication from this usually cause the death in children. And also when you put hand or spoon, the saliva that is being drained out during this confusion will not be able to come out, and instead of the saliva also going into the esophagus, because of the confusion, it will go into the airway and causing something known as aspiration pneumonitis. So please, let's try as much as possible not to give anything, because when you give and this child choke on it, it will cause difficulty in breathing, and before you know it, the child might pass away. So what to do is remain calm, let your child be on the floor. When the child finish convulsing, check the child temperature. Most of the time, it's usually very, very high fever that causes it. And one thing that a nursing mother should have at home is thermometer. This thermometer that I'm holding, you should have it at home. Then how do you read it? When you check, you press this button. Once you press this button, you can put it at the armpit, or you put it slightly this tip into the anus of the child. It's going to read. When it reads, you hear a beep sign. Then after hearing that alarm, you remove it and read it. Most of the normal temperature is between 36.1 and 37.2. So when a child is having temperature of 37.5, you can sponge the child. That is, you use warm water, not cold water, to clean the child's body. But if it is above 37.5, you give paracetamol at home. Give paracetamol at home. So then you take the child to the hospital. Note the time, how long, when you are going to the hospital, note how long the confusion lasted. Note the temperature that you checked when after the confusion. And if you give paracetamol before going, note also that, and let them know when you get to the hospital. Please go to the hospital, let them evaluate the child, because sometimes there might be an underlying cause for this confusion, especially if it is not due to high fever. There are some confusion in children that the mother said, oh, the baby is fine, there is no fever, there is nothing. All of a sudden, the child just started convulsing. Do not say it's just once. No, once the child stops convulsing, take the child to the hospital. Let them evaluate the cause of the child so as to prevent future complication in that child. So thank you.